Hi all, this is Jess, and I'm going to be recording several videos today about the second part of neurological disorders, our second piece of content for that. I'm going to start with cranial nerve problems. So let me share my screen and get into it. So this entire series today is going to, or that I'm recording today, probably not watching them all at the same time. What am I talking about? So anyway, we're going to talk about cranial nerves. Let's talk about them. Let me change one thing. There we go. So there's a few different parts that I'll be recording. Part of them are spinal cord problems, part of them are peripheral nerve problems, but the specific talk is about cranial nerve problems, and here's the pages that you can find them in the list. So if you're a visual person, this is a nice visual representation of what the cranial nerves are. So if you look here, these are all numbers, as well as it looking kind of like a person. So this is cranial nerve number 7, and this is cranial nerve number 11. And this is cranial nerve number 8. So this is how this picture does help people understand what cranial nerves are associated with what particular part of the head and of the body. So 9, 10, and 12 are here on the tongue. 5 is the whole face, etc., etc. So take a look for one of those, or draw one up for yourself if you find that to be helpful to remember which nerves to what. When people start having problems with those cranial nerves, it can be called a few different things depending upon what nerves are impacted. And this particular problem is trigeminal neuralgia. So trigeminal neuralgia, the trigeminal nerve is that cranial nerve 5 that does the whole face. And what happens, people describe this pain as a stabbing. It's like a lightning shock to the lips, upper, lower gums, cheek, forehead, perhaps the side of the nose. And it's usually on one part. It's not a global both parts sort of thing. It's just like one side of the face. And the attacks will happen for about 2 to 3 minutes, and then they'll go away. What you'll want to be aware of when you are going through SurePath and when you're going through your readings is who's at risk. What sort of precipitating factors do people have to be able to have one of these trigeminal nerve attacks? Diagnosis for people with trigeminal neuralgia includes nice robust health H&P. And then they'll also go into head CT MRI to rule out any sort of other problems that might be, perhaps there's a tumor impeding on that nerve number 5, and that's creating the problem, rather than it being a true trigeminal neuralgia. So what happens is there's a trigger zone. Touch or triggers can be causative, or touches or tickles can be causative triggers. So imagine, like, seriously, something as benign to most of us as like having our hair in our face can trigger a trigeminal neuralgia attack. So the trigger zone is light cutaneous stimulation at a specific point along the nerve branches. And like I said, light touches and tickles are considered to be triggers as well. Treatment includes anti-seizure drugs such as carbamazepine or oxcarbazepine. We can do nerve blocks, those injected nerve blocks. We can teach the person cognitive biofeedback mechanisms. Remember, biofeedback is very similar to what we did on the first day of psychosocial, where we analyzed cues that were happening in our body and then tried to use our minds to override and be aware and then override those particular sensations. Or you can have what's called rhizotomy. And rhizotomy is where the nerve is either cut or destroyed using a radio frequency current. And what will happen is that will destroy the nerves that innervate the face joint with highly localized heat or generated radio frequency. And that nerve destruction severs the communication link. So then the brain, the spine to brain signal doesn't happen. So we can use a little bit of heat or radio frequency to disrupt that communication of that pain between the brain and the spine. Patient teaching for trigeminal neuralgia includes the importance of nutrition. We want to make sure that they're eating lots of foods that are high in protein and high in calories, but that are also easy to chew. And because of temperature being a possible trigger as well, we need to make sure that they're served lukewarm, not too hot, not too cold. The Goldilocks phenomenon, right? Her porridge couldn't be too hot or it couldn't be too cold, and neither can these guys. So the importance of oral hygiene and oral care. So warm mouth washes, soft bristle brushes, but just so that and then just to be aware, other patient teaching, the condition's considered to be benign, but because that pain is so sharp and stabbing and awful, there can be a significant disruption of lifestyle, and it can really impact these people's psychosocial and physical dysfunction. So people may choose to die by suicide than live with this particular condition. Like, it's that severe. So just so you have an understanding. Bell's palsy is also a cranial nerve problem. That is due to inflammation in cranial nerve 7. Remember that on the picture, dude, 7 was the sides of the face, and that's where the facial nerve is. Cranial nerve 7 is as well. So in acute cases, it can be caused. This is one of those sort of mystery sort of things. We're still working to figure it out. But it could be related to HSV. It could be related to a virus. It could be an autoimmune problem. It is generally a benign problem. And after a few weeks or months, especially with some physical therapy and occupational therapy and speech therapy, people can recover. But what it looks like is the gal here. So the one half of the face will be, there are a lot of people who will have this initially happen, and people will be worried about them having a stroke because the one half of their face is just really flaccid. And there's not a whole lot of muscle control in this particular part of the face. So, or whichever part of the face it's affecting. So they won't be able to wrinkle their brow. They won't be able to close their eye, so they can have some really dry eyes. They're unable to puff their cheeks or do any muscle tone movements. And then they'll have a droop in the corner of their mouth. They won't be able to smile, and they won't be able to like pucker or whistle. And then there can also be a loss of taste on that side of the mouth as well. So what happens with Bell's palsy is it becomes more of a diagnosis of exclusion. Like, we rule out stroke and we rule out other problems, and then it's got to be Bell's palsy. Complications that result from Bell's palsy can be several, including malnutrition, dehydration, withdrawal, and facial changes. So if a person isn't like physically outside supporting, like they're the corner of the mouth that is drooping because of the Bell's palsy, they're going to have food kind of fall right out. It can be really psychosocially impactful because their physical appearance, they've almost got, it can almost feel like they have two faces. And then they'll have like this droop really makes it hard to eat. It makes it hard to swallow because it's impacting half of the tongue. There is going to be some collaborative care that happens with this particular diagnosis. Like I said, people can be doing exercises with PTOT. You can also be getting some electrical stimulation to be able to help return that nerve to better function. Moist heat can help, and so can gentle massage. We can treat with corticosteroids because it's an inflammation problem of that cranial nerve 7. And then for nursing care, we work with people on pain control, on adequate nutrition, and on oral hygiene. And this particular diagnosis is not forever. So I actually have a friend in Duluth who had this happen, and he is actually, you would never know to look at him now that he has this. He's very self-conscious about it still, but when he was really in his, when his Bell's palsy was really flaring, he really did look like the same gal in terms of having just no muscle tone on the one side of it, on the one side of his face. He did everything the right way, and now he is pretty much fully recovered. So if you want to have some fun, there is a YouTube embedded in Angelina Jolie's picture here. So please take a look at that if you so choose by clicking on that in your PowerPoint. This ends my section on cranial nerves. Let me stop sharing this PowerPoint. And I will see you in another chapter of all sorts of different problems. So have a great day and reach out to me if you have any questions.